This week, we explore the anatomy of the peripheral nervous system, its capacity to repair, and common injury patterns. Fun fact, the funny bone is not a bone. The pain you feel is caused by compression or impingement of the ulnar nerve along the medial epicondyle, where it is least protected. It will be important to understand the difference between somatic and autonomic nervous systems, as well as the subcategories of the sympathetic and parasympathetic systems, because the CNS and the PNS systems react differently to injury. Thankfully, the peripheral nervous system has the capacity for regeneration. With a peripheral nerve injury, you can experience symptoms that range from mild to very severe. And those symptoms will often depend on which nerve fibers were affected and whether or not they are motor, sensory, or both. Best advice: early diagnosis and treatment can prevent complications and permanent nerve damage. One example of what we'll review are the different classification systems of nerve injury and how they influence treatment programs. In Seddon's classification, neuropraxia is considered stage 1. Damage is only to the myelin. It heals usually without any kind of surgical intervention. Axonomesis, the connective tissue is largely intact. There is some Wallerian degeneration that occurs, and it may require surgical intervention. The last stage is neurotmesis. It is a complete severing, and that can result from an avulsion, a rupture, a stab injury, and this one definitely requires surgery for healing. Lab will cover nerve glides for upper and lower extremities, as well as tendon glides for the hand. We'll practice refining your technique. You will be encouraged to be aware of your body mechanics. And the challenge will be to work through the critical thinking processes of application, frequency, and parameters for these interventions. This week, come prepared to dive into treatment planning for patients with nerve injuries, and don't forget to tap into the additional resources posted in the Canvas module. Thanks for listening.